Okay, so I don't think the big stories that I'm going to share today are particularly new to anybody who's been paying attention. And I'm actually going to take a step back and go back to what I presented 2 weeks ago. So 2 weeks ago, this is what I was seeing in terms of the province's wastewater signal. And of course, I was highlighting it was heading upwards. This was a sign that things are going to start to get worse. And 2 weeks ago was a time to respond and take action because things are starting to get worse. I'll now show you what the wastewater signal is more recently. You can see that that small increase has, I think, somewhat predictably turned into a very large increase, where unfortunately now the wastewater signal is pretty close to what it was for the Omicron wave at its peak. And so I think we are probably now seeing a level of infection spreading in our society that's much closer to where it was back in the peak in January. And unlike in January, where we were doing lots of things and the province is introducing new measures to deal with this, it's unfortunately not happening right now. And there's no reason to believe that this won't continue to go up. Taking a look at the breakdown, again, this is 2 weeks ago, the wastewater signal. We could see in the north, this is Central East area is just north of the GTA. Eastern Ontario, you could see there's clear upwards trajectories where in part, the north and north of the GTA, it was actually already rivaling where it was during the Omicron peak. And then in our region, in the GTA, we're starting to see an upwards trajectory. And now 2 weeks later, we can see that those areas in the north that are starting to rival the Omicron peak are well past the Omicron peak at this point. Eastern Ontario, you can see a really massive increase. And now the GTA, us, are approaching that Omicron peak. And so if we don't act, I suspect we could be seeing something similar to these other regions in a couple of weeks. I don't think that's a surprise to anybody who's been paying attention, but this is, I think, was predictable 2 weeks ago with what we're seeing in the wastewater. And unfortunately, I think it's pretty predictable that it'll continue to get worse. Obviously, within the wastewater signal showing infections are going up, we would expect our PCR confirmed cases to start to go up, and that's unfortunately exactly what we are seeing province-wide. The percent positivity in the province, which has been going up for quite a while, continues to go up, higher than, of course, our previous waves in the pandemic, except for the Omicron wave. And if we go then to the hospitalization data, if we see infections going up, we will start to see hospital numbers go up as well. And unfortunately, that's exactly what we are seeing. As more people are getting sick with COVID-19, a fraction of those people are becoming hospitalized, and with more people, there's a larger proportion of people in that fraction, or a larger number of people in that fraction. The ICU numbers, fortunately, aren't going up very much, which is a little bit of good news, but those often lag what we see with the hospitalization numbers. Now, we take a look at what the science table had modeled in terms of our hospital numbers. You can see that they had this moderate increase scenario was going to be under 1,000 hospitalizations, and that would only occur by the start of May. We've, of course, been tracking higher than that. And 2 weeks ago, I think I showed you where we were. And subsequent to that, of course, we've continued to track upwards and are well exceeding what was the original scenario. If the peak was supposed to be in the early part of May, you can maybe guess that we can expect to see increasing numbers of people going into the hospital for quite a while yet, unfortunately. And of course, if more people are being hospitalized, unfortunately, we may eventually start to see more people passing away. And we can now start to see the uptick in that as well. So unfortunately, as infections start to spread more, we start to see more hospitalizations, and we are starting to see more deaths as well. And unfortunately, with nothing being done yet to try and address that increase in infections, I would expect that the hospital numbers and the death numbers will unfortunately continue to worsen for a period of time until at least we hit that peak, which will be probably early May, and we won't start to see the hospital numbers or death numbers perhaps start to come down until later in May, unless we take action earlier to try and address that. We take a look here at some of the Niagara data. So these are the wastewater data, and this will be from the St. Catharines wastewater treatment plant. You can see very clearly we are seeing an upward trajectory here. Hasn't quite got to the levels where we were during the Omicron wave, but we are definitely trending in that direction. The Niagara Falls wastewater plant, again, it's very clearly on its way up, not quite at where we were during the Omicron wave, but we are getting there. And just to show you one more example here, this is Fort Erie, starting to have single days where it's hitting these massive peaks. And actually that day would be the highest we've ever seen in Fort Erie. Obviously the wastewater numbers jump up and down and you get these, odd peaks, but the average is fortunately, hopefully not quite as high as that yet. But definitely, we're seeing a concentration of wastewater signals at this height, which is not too dissimilar from where they were concentrated during the Omicron peak. So definitely we are seeing the wastewater numbers go up. As we would expect, therefore, our PCR confirmed cases are also going up. Percent positivity has consistently been going up as well, which matches with that. One bit of good news is that our outbreak numbers were going up for a while, but have fortunately stabilized and aren't continuing to go up. So that's certainly welcome news, recognizing, of course, that we're only looking largely at outbreaks in healthcare facilities because most other locations can't get PCR testing, so we don't find out about those outbreaks. And it does imply that at least, the extra vaccination we've done for these healthcare facilities, the 4th doses that went to long-term care early, are hopefully preventing them from seeing as many outbreaks. And then when it comes to hospitalizations, unfortunately, the story is not nearly as good. As I've shared for a while, we have been seeing our hospital numbers on their way back up. Fortunately, the ICU numbers, not so much. People being primarily treated for COVID-19 likewise are heading up, and you can see the shape of that line is really mirroring the shape of the overall hospitalization numbers for people who have tested positive for COVID-19. So people primarily infected with COVID-19 would be the driver of that, I would think. We can see actually the number of people being hospitalized per day has gone up over the early part of this month. So we were previously seeing about 1 new person being hospitalized every day, and that's closer now to about 2 people being hospitalized per day. And of course, higher number of people being hospitalized per day is going to mean that that hospitalization number overall will keep rising. In Niagara, across all our hospitals, over 100% of the acute care beds are occupied right now. So there's definitely not a lot of spare capacity in our hospitals. Fortunately, when we look at our death numbers, we're not necessarily seeing that rise there yet, but it can only be a matter of time before we start to see that, especially now that we've seen our hospitalization numbers going up. And to summarize, where we are in Niagara since March 16th, which is similar to what I talked about last time. So our PCR cases are on average up by 113%. You may remember that this was back around 27% or so 2 weeks ago. So there's been a pretty sizable increase since then. Outbreaks, fortunately, have stabilized, but they stabilized only after doubling. Our hospitalizations now are up 189% since about 4 weeks ago or 3.5 weeks ago. So that's, almost doubling. And if we're looking at people hospitalized primarily for COVID-19 and not happening to maybe test positive after they were hospitalized for some other reason, we can see that is more than tripled with 227% increase in hospitalizations for that purpose. So definitely we are seeing worsening trends all around here in Niagara, which I think is consistent with the province as a whole. And I really do think it is time for us the province to start to take some more assertive action to deal with this. I know the province said that we would expect an increase and we expect a bump in infections as we lifted all measures, which I think we have seen. But I would argue that the sheer size of this is much greater than anybody expected. And I think if we could at least, try and mitigate what we experience through the rest of this wave, we can lessen the number of hospitalizations, we can lessen the number of people passing away, and we'll have a better chance of weathering this storm. If we don't take any action now, that upwards trajectory I showed you in our wastewater will start to reflect in our infections, in our hospitalizations. And who knows how well we will be able to weather that, how well our hospitals will handle that. And more importantly, the suffering that people in our community will go through if they're being hospitalized, if they're suffering really difficult illness. I really do think it is time for the province to start to take a little bit more action on this front. When it comes to our vaccination numbers, there's not a whole lot of interesting news to speak about there. Orange are our first doses, blue here are our second doses, and green are our third doses. Don't yet have any data on fourth doses. That's hopefully something we'll be able to add in future weeks and put on our website soon as well. Still, the big area where we need to see improvements in vaccination is in the kind of 12 to 60-year age group, where the third doses really continue to lag, and there's a lot of room for improvement. Of course, love to see higher vaccinations amongst the 5 to 11-year-olds, because we are sensing there's a lot of infections, unfortunately, going around in schools. I do think that getting these people third doses is, a really high priority, and certainly higher priority than maybe some of the older groups getting fourth doses. 80 plus, of course, are a group where we do think very much do need to get fourth doses, because they are the highest risk of being hospitalized going forward. In terms of our vaccinations being administered, we have seen a little bit of uptake, and that is largely, I think, people who are coming out for their fourth doses now. We're not necessarily seeing a lot more people signing up for their first, second, or third doses. Of course, we are available with our clinics for first, second, third, and fourth doses. First, second, and third, you can walk in. Just manage the numbers of people we'll have for fourth doses. For the moment, we are doing appointments only for that. And over the next few days, we are at the Seaway Mall and at Canada One Outlet, and then we'll be at the Canada One Outlet for the balance of the week. We will, I note, be closed on Good Friday as a holiday. We have seen generally low uptake of vaccinations on those dates, and so we're going to be closing on that date. But we'll be open on the Saturday and Sunday then again. So I've talked a lot about the need for the province to take some action, and I'll highlight what I think really needs to happen. First off is I think it's time for the province to reintroduce mask mandates. Last week, 2 weeks ago, I was talking about how they need to have stronger messaging. I think we're now past the point where that stronger messaging is going to be sufficient. We're seeing wastewater signals showing similar levels of infection to the Omicron wave. It's time to take a much more aggressive action, which I think means the mask mandate needs to be brought back by the province across the region. I think it's important to remember that mask mandates don't limit our ability to go about our social activities. We can still partake in all of the different social settings and amenities which are now reopened. We're not proposing those be closed, but that we at least have masks in place so that we're protecting everybody when they're out in those social settings. I think it's a common sense measure that we can take to limit the spread of infection during this time. Still shows us stepping back from the more intense measures we had during the pandemic, but also recognizes we are in a wave, we are seeing more people being hospitalized, more people passing away, and we do want to try and prevent that. I do think, the province does need to have stronger messaging. They're not saying a whole lot about vaccination, they should do that. And even if they don't bring in the mask mandates, which I think they do, they really need to have stronger messaging around masks. It's not about personal protection, it's about protecting our entire community. The message should be everybody needs to be wearing a mask, and everybody is an adult who needs to be getting that third dose to make sure that we're all getting that vaccine that can prevent spreading infection to others. We need to improve access to treatment, and I'm highlighting people 50 years of age and over. Still have not seen a lot of promotion by the province on testing. On treatment. I really think there needs to be much more promotion about treatment, who is eligible for treatment, and that they should be connecting with their primary care providers to find out if they're eligible and be in line for that. There is an announcement happening by the province today around eligibility for testing. And from what I'm understanding is that they're going to increase the number of people who are eligible for testing. That's, perhaps slightly good news that more people are eligible for testing, but I think that just means that people who are lower risk, the people who didn't need testing as much, are now going to become eligible, so they can start to get treatment moving, and they don't have this bad headline that there's only a few hundred doses given out of their 40,000. It's not addressing the fact that the people who previously needed treatment and weren't getting it are still not getting still probably not going to be getting the treatment, and we really do need to have the promotion there and work to try and get treatment to the people who need it, as opposed to just expanding the eligibility to people who don't necessarily need it. To that end, I think we need easier pathways to access treatment. It's far too complex for people to figure that out. And we need to have expanded testing as one of those pathways. So I would propose anybody age 50 and up should be eligible for PCR testing. And if they're eligible for PCR testing, that means at the assessment center, we in public health will know that this person is a candidate for testing or treatment, and we can put them into the pathway for treatment right there and then to make sure that they get treatment. And I think having expanded eligibility for testing and being able to promote that is a simple message that people can understand, which is, I think, much more complex to understand right now, giving the complexity of who is eligible for treatment. So we need to do a lot more here. And the sense I'm getting is the province's announcement to expand eligibility isn't going to help that much because it's adding other people to be eligible for treatment who are lower risk, as opposed to making sure we get access to treatment and understanding and promotion of treatment to the people who really need it, who have thus far not been accessing it or not been able to access it. We need to continue to promote a culture of staying home if people are sick. If people are sick and showing up to the workplace, to school, they're going to spread infection. We need lots of public messaging to reinforce this. And I think the province needs to make paid sick days permanent and increase the number of paid sick days so that people are never working because they feel they have an economic need to work, and unfortunately in the process putting people at risk. And I still believe the province needs to update their proof of vaccination tool to incorporate third doses as a signal to remind people of the importance of vaccination so that they start to go out and get vaccinated, so that workplaces who are trying to keep their place safe from unvaccinated people have a tool that aligns with the best evidence on vaccination, which is you do need 3 doses. And then this sets us up that we can bring back proof of vaccination to public settings if that becomes necessary, and reintroducing the mask mandate isn't enough to mitigate the spread of infection. And I think we need to see action across all of these areas by the province, where unfortunately I think we're not currently seeing a lot of action by them. And I'm hoping that the provincial press conference that's actually dealing with COVID-19 today will be the start of at least doing some of this, at least picking off the easy work around messaging, and we can start to build off on a more aggressive and assertive provincial plan to deal with COVID-19 going forward. So I'll stop there and turn over for questions.
Okay, thank you. First up, we have Alan, and you should be able to unmute now.
Hi. Perfect timing. Okay, let's shut that. There we go. Okay. Just as you were speaking, as I'm sure you're aware, the province did announce that it's expanding access to antiviral medications as well as PCR testing. I think you've more or less addressed that, though, in your statements. So the access, though, isn't specific enough. Just to clarify, I mean, it needs to be more geared towards people who are at a higher risk. Do you believe, or?
Yes, I do. So, there's lots of access issues that people are currently experiencing. First off is there's a limited number of places across the province that can even give out treatment if you are eligible for it. That means that there's long travel for some people. If you think about in Niagara, there's the one site. If someone is living in West Niagara, that might be quite a long trip for them. They may have transportation barriers. We're often dealing with elderly people who have underlying medical conditions who are going to have some struggles with that level of travel. So I think that's one really concrete example of barriers. Another is that you need to go to one of those clinical assessment centers to be assessed. Your primary care provider can give you a referral, but they can't necessarily do that. A pharmacist can't necessarily do that. There's lots of opportunities there, I think, to increase the number of professionals who might be able to play a role in doing some of this and helping people get into treatment earlier. I think people's understanding of whether they're eligible for treatment or not is lacking right now. It's a very complicated matrix that takes into account your underlying medical conditions, your vaccination status, other risk factors that you might have. And it's difficult, it's not even something I can quickly and cleanly explain to you now. You really need to look at the guidelines. And for that reason, I think it's complicated for people to understand. And that complexity means it's harder for people to know if they should go and reach out for treatment. And the one other thing to note is that, of course, the people who are most going to go access treatment are the people who take COVID-19 seriously, who are worried about their illness. They're also likely the people who, because they're worried about their illness and are listening to us and taking things seriously, went out and got their 3 doses of vaccine and are probably now getting their 4th dose of vaccine. The people who are most in need of this treatment are probably the people who aren't taking this pandemic as seriously, not listening enough to us, And we need to really have some sort of messaging, some sort of outreach to get to those people to help them. And that I don't think is happening right now. And so those are some of the gaps I'm seeing that I think what the province is announcing today isn't really going to address.
And a follow-up?
Excellent. Thank you so much. Earlier today, you retweeted Dave Fisman's statement about increased pediatric hospitalizations. Are we seeing that in Niagara? And just looking at the stats from the Niagara Health, it doesn't look that we are. And I'm wondering if you have any insight into why maybe that is the case.
Yeah, so I think if there were children hospitalized, they might not necessarily show up in Niagara Health stats because Niagara Health is not a pediatric hospital. Children might get admitted at McMaster's Children's Hospital or another hospital. That being said, from the stats we're not seeing many children hospitalized, thankfully. I think the reason for that is actually the risk of a child being hospitalized remains actually quite low. It's just that it's not as low as it was before. So it's still something that's going to be relatively rare, but it's going to become less rare. And at least on a province-wide basis where you're dealing with a much larger population number, you're going to see more children unfortunately start to be hospitalized. I showed you the wastewater signals where really Northern Ontario, the northern part of the GTA, Eastern Ontario is where we've seen the biggest increases in COVID-19. And I imagine that's where the hospitalizations in children are more concentrated right now. And they haven't yet come here because we're only now seeing the much larger increases in infections here. But unfortunately, I do worry we're going to start to see some children hospitalized here as well.
Okay, thank you. Up next, we have Abby, and you should be able to unmute.
I just have one quick question. You mentioned that the province should probably reinstate mask mandates. If they don't, and if they continue to not do that, is that something that you could or would consider doing for Niagara yourself?
Definitely something that we could do. I've been very open. That is something that we are considering as something that we would act on if the province doesn't. At this moment, we really want to make sure the focus stays on the province. This is a province-wide issue. It is not a Niagara-specific issue we're seeing. Niagara is fortunately not the worst affected in the province. I think we need to have provincial action on it. I think if we act locally and we're a little island where this comes back, it's not going to work as well. There's not going to be the same buy-in that it's needed. There's a lot of travel in and out of Niagara, so people are going to be at risk when they're outside of Niagara. They're going to be in Niagara and perhaps spreading infection. We're not going to get the full benefit of that mask mandate if it's only Niagara specific. It really needs to be province-wide, and I think the focus really needs to be on the province and really encouraging and recommending that they do this right now.
And follow-up?
Nope, that's it. Thanks.
Okay, thank you. And up next, we have Penny, and you should be able to unmute.
Yes, thank you. Dr. Hergé, you said the issues around antiviral medication, they are complicated. It's complicated as far as who is able to receive it, and we need advice from healthcare providers to start with. But what is also complicated that I'm kind of hearing just from conversations is people understand that they need to maybe start with seeing their doctor, but they don't really understand the process after that. Is that as complicated, or is that something that you could explain? First, you go to your doctor, then you go to the assessment center, and you get a prescription. What happens after that? Could you maybe make that a little less complicated for us?
Absolutely. So the first thing you should do, you have any symptoms of COVID-19, you think you might have COVID-19. If you have a rapid test at home, great, take that rapid test. But whether it's positive or negative, call up your family doctor. Either way, that rapid test might not necessarily be accurate in the first couple of days of infection, and make sure they know that you are sick and that you're concerned about your health and want to be tested and be put into the pathway for treatment. What your family doctor will do is they'll refer you to the clinical assessment center run by Niagara Health so that you can then be assessed for treatment there. That means, unfortunately, making the trip out to the GNGH hospital where they have that clinic. At that clinic, they'll go through all the risk factors you have and make a decision whether or not you're one of the people who is eligible for treatment because you have the right number of vaccinations, risk factors, etc. but they'll also take a look at what are your medications. And unfortunately, with the medications we can prescribe for COVID-19, there's a lot of interactions and side effects that are linked to some of the other medications. So you actually sometimes need to adjust some of those medications that you're on. And so that's really important for why they need to assess you at the clinical assessment center, because they have the expertise to figure out how much are all your other medications and they're going to need to change if we prescribe you either Paxlovid or remdesivir as the antiviral treatment. At that same time, they're also going to do a test for you, and they're going to actually do a better kind of rapid test that is more accurate to find out if you're infected with COVID-19. And if you are indeed infected with COVID-19, they'll prescribe you your medication for COVID-19, as well as prescribe you an altered regimen for your other medications so that you can take those. If you get a Paxlovid, that is going to be a 5-day course of medication. Remdesivir is, I think, 3 days of actually IV treatment, so it's much less convenient, but for people who can't get Paxlovid, it may also be an option. And both of those options will reduce the risk of being hospitalized or having a severe outcome from COVID-19. The really important thing, I think, for individuals to know, though, is that as soon as they have symptoms that they're worried might be COVID-19, is call their primary care provider so they can start on this way. At that point, there's nothing more that you as an individual need to do. Your healthcare provider, the clinical assessment center is going to take care of everything. The key thing is, though, you need to initiate that as soon as possible because those medications only work within the first few days of illness. But hopefully that overview gives a little bit more understanding of what happens after that point where the family doctor gives you the referral.
And a follow-up?
Not really. I think you've just really made it sound a lot less complicated than we were thinking. It's really just 2 steps. Talk to our primary physician and then go to the assessment center. And if it's either treatment is right, the prescription and the medication is made available then.
Yeah, exactly. The complexity is, I think, actually more on the healthcare provider side to figure out if you're eligible for treatment, to assess your medications, make changes to that. All of that, I don't think a person needs to worry about.
Okay. Thank you.
Okay, thank you. So we've come to the end of the first round. So if anyone has any second questions that they'd like to ask, if you can just let me know in the chat and we'll let you unmute. Okay, well, not seeing anything, we'll end things there and see you all again in a couple weeks. Thank you.